In the AFC Championship game, we saw Cincinnati Bengals tight end CJ Uzomah go down with a very bad looking knee injury, and this one looked very concerning from the get-go because it did require him to be carted off of the field. Now, initially there was a lot of speculation regarding this knee injury because it did look so bad when it occurred, but recently Zac Taylor, coach of the Cincinnati Bengals, came out and he described the injury as encouraging. Now, there is a grading system for these MCL sprains, and based on the grade of the injury, that will give us an appropriate timeline for return to sport. And since some people may not be too familiar with the grading system for an MCL sprain, I'm going to go ahead and focus on that with this video. Welcome back, sports fans. For those of you that aren't familiar with me, my name is Mcl and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they're a little bit easier to understand. And then I'll go over the rehab process. If you like this video and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now, here we see on the actual injury video that as Uzomah jumps up for the pass, he's going to come down very awkwardly onto that left leg, and it just looks like it buckles very badly. Here I have a model of the knee, and so the knee joint is going to be formed by the femur bone, which is the thigh bone, coming on down just like this, and coming up from the foot, we're going to have the tibia, which is the bone we often associate with as the shin. That bone is going to come up like so, and then on the side here, we're going to have the fibula bone. Now, there are 4 major ligaments that contribute to overall stability of the knee, and the first one that we hear a lot about is the anterior cruciate ligament, or the ACL for short, which is located right in through here. Then, as we go towards the medial or the inside portion of the knee, this is that medial collateral ligament, or the MCL for short. As we move on to the outside or the lateral portion of the knee, this is where that lateral collateral ligament, or the LCL for short, is located. And finally, as we look onto the back of the knee here, this is where that posterior cruciate ligament, or the PCL for short, is located. There are also 2 other really important structures located within the knee, and they are, of course, the medial and the lateral meniscus. You can think of these as essentially shock absorbers between the 2 bones. Now, we know that fortunately in this case, only the MCL is impacted, and whenever a person is going to have force coming from the outside of the knee, that is going to, as you can see here, stretch that MCL right in through there. Now, so far, we know that only the MCL has been impacted in this injury, so that is going to be that medial collateral ligament right in through here. We can see here that as Uzomah is coming down to the ground, that leg gets bent very awkwardly, and it's actually placing a force going from the outside of the knee, going towards the inside of the knee, and we call this clinically a valgus force. Now, when this happens, you can see on this model here that as a force is coming from the outside towards the inside of the knee, this is going to stretch and strain a lot of that MCL. So when he falls down to the turf in this awkward motion, this is why that MCL is impacted. It's also important to say that yes, not only the MCL can be impacted in this case, which is why initially there was a lot of speculation about potential ACL tear or any other type of structure located in the knee. But fortunately, right now, we know that it is just going to be a sprained MCL. Now, there is an on-field test to determine whether or not we think a person has an MCL sprain, and this is called a Valgus Test, just like the force that comes from the outside going in, which will cause the injury. Now, essentially what we're going to do here is we're going to stabilize the person's leg, and we're going to place a force going from the outside in. And as you can see on this model, I'm placing the outside in force, which would impact in through here. And if a person has any pain, or if we feel laxity, or both, then this makes us believe that the person potentially does have an MCL injury. Now, there is a grading system for these MCL sprains, and they are, of course, grades 1, 2, and 3. In a grade 1 MCL sprain, this is when the affected MCL is going to be stretched, but there's not going to be any tearing. In a grade 2, this is when a person is going to have overstretching and some partial tearing of the MCL. And finally, in a grade 3, this is going to be a complete rupture of the MCL. Now, of course, depending on the grade of the MCL sprain, this is going to greatly impact the timeline that it takes for a person to return to playing sports. Now, in a grade 1, because there's some overstretching of the ligament and there's no partial tearing at all, typically a person is going to be able to return to sports between 1 to 2 weeks, depending on how they feel. If the grade is more of a grade 2, where we include the partial tearing, Then this can take upwards of about a month. And finally, in a grade 3 MCL sprain, this is when a person, once again, is getting that full rupture of the ligament, and a lot of times the knee is very unstable. So this can take upwards of 2 or more months. It really just depends on how the person is presenting. It's also really important to say that a grade 3 MCL injury usually is accompanied by some damage to another structure in the knee, whether it be the ACL or meniscus. So at this time, we have not been told that any other structures have been impacted. So it seems like that it is not a grade 3 injury. But once again, we do not know the specific grade of this injury, but obviously the best case scenario would be that it is a grade 1 MCL sprain where the recovery time is anywhere between 1 to 2 weeks. Now, typically when we see a person coming into physical therapy for an MCL sprain, what we're going to do immediately is we're going to use that RICE method, that acronym RICE that I refer to so often on this channel, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. This is very important because in the initial phase, the inflammatory phase, this is when a person is in a lot of pain, they have a lot of swelling to the affected area. So the goal of this is to try to pump as much swelling and inflammation out of there as possible. Then as a person continues to progress within therapy, then we're going to work in range of motion exercises to fulfill the full range of motion of the affected knee. Then after that, we'll get into some strengthening to make sure the quad and all the surrounding musculature is firing properly so that they can return to sport. A lot of times this is going to be accompanied by a period of non-weight bearing, and we saw that as Uzomah came back to the game, he was on crutches and wearing that very big knee brace on the affected leg. So it looks like as of right now, he's already fulfilling that non-weight bearing requirement. And I can imagine that he is following the RICE method and progressing as fast as possible to potentially return to the Super Bowl. Hopefully he can make that date, but once again, it really does depend on the grade of the injury. So we're going to need to wait and see if any of that information is released to us. If I happen to hear any more updates regarding Uzomah's case, I'll be sure to update everybody in the comment section below. Also, if you happen to hear anything, please feel free to update everybody as well. And that's it as of right now regarding CJ Uzomah's most recent knee injury in the AFC Championship game. I really wish him a lot of luck moving forward because he did have a great regular season, and I really want to see him do very well in the Super Bowl. So a lot of luck to him moving forward. And once again, if you really like today's content and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future. Thank you for tuning in, and I'll see you next time.